Hi, everyone. Melissa Turner, the Tooth Girl here, coming to you on behalf of Spark Study Club. We have an exciting virtual webinar coming up on August 27th at 8 p.m. Eastern. And now this time we have not one, but two industry experts presenting that evening, Dr. Michael Miyasaki and Kristin Evans, BS RDH. Now, this course is sponsored by IOBio and will cover illuminating patients' needs, advancing care through biofluorescent technology. So you can go ahead and register at sparkstudyclub.com. You'll earn one CE credit for this lecture, and please know we have limited seats remaining. So before that happens, we wanted to take a couple minutes today to help you get to know both presenters and give you a sneak peek of what they'll be discussing. So we'll begin with spending some time with Dr. Miyasaki, and then in just a bit, we'll invite Kristin onto the podcast as well. So Dr. Miyasaki, thank you so much for being here today.
Oh, thank you for having me and Kristen on. We're really excited about the webinar coming up.
It'll be a good time. I'm excited for it too. But so for those who don't yet know Dr. Miyasaki, he is a graduate of the University of Southern California School of Dentistry, and you've practiced in Sacramento for nearly 4 decades. There you go.
Long time.
Long time. We're not going to say
Yeah.
that. No.
Yeah, no.
A well-respected educator and international speaker, he's held multiple executive roles, and his lifelong passion lies in improving patient care through advanced materials, meaningful education, and innovative product development. And now this is something, Dr. Miyasaki, that you and I have in common. So love it already. Wonderful. But I want to just for the audience dive straight to the point. Why biofluorescence and why now?
Yeah, you know what? I think for the those that are on this, if you ever have a patient that doesn't quite understand why you're making a recommendation, there could be decalcification or there could be a cavity or inflamed gums, and you're telling them what you think would be best for them, and they just don't seem to understand or buy it. Or if we have situations where sometimes we look at small cracks in teeth and we don't quite know if that's a cavity we should take care of, or the cracks, like I had a patient this morning who had cracked her tooth, the tooth number 31. And so we used the Bliss technology to not only visualize that crack, but actually to kind of diagnose how deep that crack went with the bioluminescent technology or fluorescent technology. So by pulling this all together, now we have tools to help our patients understand their condition, why we're making those recommendations, and so we do more treatment because we can see the cracks in the teeth easier and the decay, so we can make our diagnosis better. Our patients are more on board because we can show them those areas of concern, and we can show them not only the brown stain, but then the red that glows because there's bacteria in that little crack or that area of decay. And so you build more patient loyalty, you're doing more work. And I think from a patient acquisition point of view, patients today are a lot more sophisticated than they were 40 years ago. 40 years ago, we'd say you have a cavity in that tooth, you need to come back and we're going to put a filling in that tooth. Whereas today with YouTube, we have all the Dr. YouTubes and the Dr. Googles that are kind of self-diagnosing. And I think patients like to understand why you're making those recommendations so that they know that that health decision is a good decision, or if they're going to pay you in part with their money, why they're going to do that. So all these tools, there's four different pieces of equipment. And again, we'll talk about how I have integrated those pieces of equipment into our practice. But from your very first visit, the new patient examination, we take some photos. We start to show them the red that shows where the biofilm is, all the way down to when we're doing the actual procedures. It could be a hygienist doing root planing and scaling. It's difficult sometimes to see the biofilm, so we've got equipment that's almost like a curing light. You put goggles on and you can actually shine that in the mouth and see areas of biofilm that's remaining. So if you're doing things like EMS and the guided biofilm removal and all that today, it really helps to do that. And then there's a small unit called the Scan Plus where the patient can actually take it home and they can monitor how well they're doing with their biofilm removal. It's always hard to tell a patient you've got a lot of plaque here and they really don't know what they're looking at. They can't really see it because it kind of matches the color of the teeth. But when they use the biofluorescence technology, they can see the red along the gum line, and it really stands out. So now they kind of know where to target. And I think it kind of makes it a lot more fun. And for kids, they can see where it is we're trying to get them to brush, and adults can see because I don't know about you. I know you've been doing this for a long time too, but I always tell my patients A toothbrush is called a toothbrush, but it really should be called a tooth and gum brush, right? So we should take that toothbrush and get down at the gum line. It's not just for the teeth. And again, this biofluorescent technology helps in us see all the disease or potential disease that's at the gum line. And just
Mhm.
one more thing, and when we talk about biofilm, and when you think about biofilm, biofilm causes gum disease, bone loss, decay, and the oral systemic diseases that we have today. So really what this biofluorescent technology allows us to do is see the bad guy that's in the mouth and better educate our patients.
Mhm. And I feel like that's almost, been one of these things that's changed since you've been in practice, certainly since I've been in practice. It used to be, we'll date ourselves, we'll say pre-internet. It used to be that the patient would come to us and we were the expert.
Hmm.
Now, like you said, now they have Dr. YouTube, they have Dr. Google. So now they come to us with the information, and now it's our job to help them sort through the information. But along with that, we live in a visual world. And so the minute that you can show them a picture of something, they're sold.
Yeah.
I feel like that's it. And so with this illumination technology, they're sold, like you were saying. They can see the biofilm. They don't have to go get a second opinion. They don't have to Google it again, right? It's their own mouth, real time. They're sold. So you're saying there's four different technologies that the clinician can use, but then also one that goes home with the patient. Let's save that one till the end. I want to talk about that at the end. Can you run through again the three other technologies that we can use in office?
Yeah, yeah. I mean, going back to what you were just saying, it's kind of like we don't look at our Instagram account and turn off the video part, right? Everybody does the visual, and usually we don't even use the audio. So, yeah, that's why the visual part's so important. So the first one is almost like a camera. And so when the patient comes in, in the past, what we've done for our new patient exams is we would take photos of the smile, a front, either retracted or not retracted, right, left, and occlusals. So this is a larger camera that will basically do those photos. So instead of using a different camera to do those, today now what we're doing is we're just using this larger camera to get those extra oral photos. But what this camera does is when you activate the shutter, it's digital, but when you do the shutter and it takes the actual photo, it's taking one of the teeth as we would see them, but then it also does a biofluorescent image so that later on when we go to review the images, we can see what the smile looks like, and then we can see the smile on the smile image where all that biofilm is. So it
So it
does
does
both
both.
photos at the
A
same time. At the
regular.
same time.
Yeah, I
Yeah.
didn't realize that. Okay, that's a
Yeah.
big deal. So you don't have to double up. You don't have to break out your
No.
cameras. Okay.
No, yeah, so we're not taking two separate photos or having to adjust the setting in between. It's just taking two images and we got both. And so we start with that. And then what we do is there's an intraoral camera, and the intraoral camera does the same thing. It's just like the little wand that we're all used to. You go through the mouth, you give the patient the tour of the mouth. But the
Mhm.
same thing when you capture an image, it's taking two images. It's taking an image, let's say, of that tooth, but then it's taking an image of that tooth with the biofilm. And so if you've got interproximal decay, sometimes that will show up, or if you've got a crack in a tooth and there's bacteria that's gotten into that crack, it'll show up. So from the dental perspective or the dentist perspective, it's nice for us to diagnose teeth. And then the other thing is if you've got like a porcelain veneer on the front teeth, we've
Mhm.
seen this where we use that camera and it actually show us decay going up underneath that veneer. That when you look at the veneer from just looking at it with your eyes, you can't see it. It looks fine. And
Mhm.
then from a hygiene perspective, you can go in there and show all the inflamed gums. You can show the tartar buildup. You can show all the things that you want to show the patients bleeding when you are going in there. And the other
Mhm.
nice thing about all the technology, all four pieces of the technology, is that there's no pain involved, right? You're not poking, you're not doing anything. It's just basically taking pictures. And so the patients, are comfortable, and now they're getting curious because you're showing them all the things that are going on. The
Mhm.
third piece that's not the patient piece is again, it looks like a curing light. And so you put goggles on, and it comes with two sets of goggles. So the patient can wear a set of goggles, you can wear a set of goggles, and it's just a curing light. You can go around the mouth, and as you go around the mouth, it shows you the red where the biofilm is. And so it's just a great patient education tool. If you're doing the hygiene services that day, as you're going around, you can show the patient where that plaque and biofilm is before you do anything, and then you can go back and show them where the biofilm is after. because I don't know if when you're a hygienist, it's funny. We have multiple hygienists, and sometimes a patient will say, "I really like that hygienist," or "I like that hygienist." I don't. It's usually a lot of it's personality, how people get along. But then sometimes it is, well, that hygienist got my teeth cleaner than that hygienist, and you don't really understand how the patient understands that. So I
Mhm.
was telling our team, because there's four of us that do prophies and root scaling and planing in our office. I go, if we use this light and we show the patient where all the biofilm is before we do the procedure, and
Mhm.
then when we're done, we go back and we show them, hey, we removed everything. Then I think it creates more of an even playing field where now the patient understands that, everybody that does a hygiene procedure in that office does a good job. So, I think that's a good thing too.
It'll help calibrate among clinicians, but it'll help
Yeah,
also help
yeah.
prove to the patient. I know. I think that was one thing. I had some patient always you always have those patients that are like, oh, she didn't hurt me, she didn't do a good job, or he hurt me and he did a
Yeah,
bad job. Like it's complete opposite, but it's
yeah,
all like what they think is clean, right? So that I think to me that takes the pressure off of, having to prove that we did anything, or vice versa too. You have those patients that come in and they're spotless, right?
yep,
Complete. There's no plaque or calc or anything
yep,
anywhere, and you still want to make them feel like they're here for a reason, right? So this
yep,
break out this tool and show them how good of a job they're doing. Now,
correct.
how does all of this technology differ than what we've had in the past, though? That's another thing I want to touch on before we have to hop.
Well, I mean, you're right. It depends on where we're comparing it to. So if we go back and talking about how old we are, back in the day, we didn't even have fax machines. It was we were
I
talking
remember
about the
those
internet.
days.
Yeah, but talking about the old days, I mean, what we had was dye, right? So we might put a couple drops of dye, it could be red or blue in the patient's mouth, have them swishing around a little bit and spit it out into a cup. And then we'd have them hold up the mirror so we could see where the biofilm plaque and everything was in their mouth, but it was also all over the lips and maybe all over their clothes. So, that's still being used today. So we were moving away from that just because patients don't like it and it tastes good and it was just they'd be wearing that dye in their mouth for a while when they left your office. So we've got that, and so this is very similar to that, but a lot more convenient. And then there are other tools that use the biofluorescence technology, but I haven't found them to be as useful or as broad in use. So the what we talked about, we have the camera that's very easy to use to get large areas photographed and to show the biofilm. Then we can get in there with the intraoral camera. So I think what I like about what IO so IO is a company that produces all this, is that it's really a suite of equipment pieces that come together very easily. It doesn't disrupt your workflow, but it just increases the value of what we do for our patients. And so I think that's the nice thing I like about it.
Mhm. And I like that because it does take those regular photos, then you know where you can already implement it into the workflow, right? It's not like you're creating a different workflow to add this in. You're already taking photos, just replace it with this technology.
Yeah.
That's good. So one of the things, and last thing before we have to go, but one of the things that I know is going to be so much more important in the future, and it already is patient data, right? We are collecting patient data, the patient owns their data, right? But we live in an age where now we're able to collect so much more information about a patient. And now also because they can do things at home, like remote patient monitoring, wearing Fitbits, mHealth devices, things like that. So just let's focus for a little bit on this, on the home device, and then how that can help us when the patient comes into the practice.
Yeah, I think that's a great point. So that's part number four, and that's the kind of the home care version of what we can offer our patients. So because you're absolutely right, there's a lot of us that are kind of moving into some kind of teledentistry, whether it be uh, webinar type calls like this that we do long distance. And having something like it's called the Scan Plus. So that's the unit that goes in the patient's mouth, and it's very easy. They just kind of put their lips around it. They hit a button, it illuminates the teeth and can show you the biofilm. So if you have patients that are maybe even with home care and they don't have good hygiene, one of the nice things is many of us have patients that are like in long-term care facilities or a nursing facility of some sort, even the hospital. And if and we see these patients come in and their home care usually is really bad, and we talk with the family, is somebody taking care of their dental care, and the family's like, yeah, we think somebody is. And we know it's very difficult to brush somebody else's teeth, much less your own, and floss somebody else's teeth, much less your own. But if those healthcare workers could just use this light and shine it in the patient's mouth so they could see the biofilm and make sure, that they're doing a good job getting that off, I think that would be really helpful. But if we've got patients that we're able to dialogue with, again, long distance, we could use that light technology. And even if we did a call like this, because I've done it where I videotaped the screen, you can see the red. And so if we had a patient that was at home and they could put that little unit in and hit the button and allow me to see how the red looked like, if they're removing it all, if there are any areas that look like there was decay or inflammation of the gums, it's just another tool that's just very easy that gives us more insight than what I can typically see on a video camera when I'm talking to a patient. Because again, it's hard for the patients to see the plaque, much less when we're on a call like this. And if I'm trying to look at your gums, it's very difficult. So it's another great tool to allow us to use teledentistry and be more effective.
Mhm. And that's, teledentistry, virtual care, telemedicine, whatever you want to call it. That's one of my biggest passions in the industry because we're underutilizing it. And you brought up a good point. Right now we have all our baby boomer patients who are about to leave the practice. They can't drive anymore. They're just losing autonomy. And this virtual care, this type of technology is exactly what we need to keep them as active patients in our practice. They don't have to leave. They can still be active patients from home using virtual care, and then maybe even a little mobile care, something like that on top of it. But it's such an underutilized technology. But I know, give us a couple years, everyone's going to be using it. It'll be mainstream. And we're just in that transition period right now where we're seeing all these amazing, technologies like iOBio coming out so that we can actually implement this too. And I want to invite you and iOBio and anyone who's listening to, we host a teledentistry conference every February. And this
Okay.
year it'll be out here in Portland, Oregon. And this is a lot of what we talk about is how do these technologies help us gather the data, right? Keep us connected to our patients so they're active patients and really provide best practices. So yeah, thank you for mentioning that. And patients have been receptive of this, yes?
Yeah, yeah. No, the patients, I just used it this morning. It was again tooth 31. The patient had a crack, and so we used the one that's like the intraoral camera to show her where the crack was, and then with that biofluorescent technology, it showed that crack and it lit up red. And so I told the patient that red is the bacteria that's been getting down that crack. And unfortunately, it was a vertical fracture in the distal of tooth number 31, and we had to extract it. But even she commented, she said how it was nice that she was able to see that before we did the extraction, because nobody wants to lose a tooth, much less go through the procedure of losing a tooth. So she felt a lot better being able to see it. So yeah, it's something that we use in our practice every day, and it really is fun.
Yeah, yeah. Well, Dr. Masaki, thank you for sharing your experience. Thank you for this upcoming webinar. And if anyone has questions, where can they reach you? Where can they find out more about iOBio?
Yeah, on iObio, they can go to iObio, and it's spelled AIOBIO.com. So they can go to iobio.com and check out some of the equipment that we've been talking about with this. And yeah, if you want to follow us, we're Miyasaki Dental is kind of, you can follow us there. Or if you need to reach out to me, it'd be great to answer any questions that anybody has. And my email is just drmiyasaki@gmail.com. So yeah, reach out.
Thank you for being here.
No, thank you very much.
Hi, everyone. Welcome back to the second half of today's show. Now I'm here with Kristin Evans, affectionately known as the PH hygienist, and she'll be taking the stage alongside Dr. Miyasaki during the upcoming webinar. So, Kristin, thank you for being here.
Yeah, thank you. I'm so excited to be here.
Now, for those who don't yet know Kristin, she is a nationally recognized educator with 30 years of experience. Nice job there. She is a graduate of Idaho State University, a leading voice on oral systemic health, functional nutrition, bone health, and of course, the effect of pH on the oral environment, which we do not talk enough about. So I'm hoping we can get into that just a little bit in the few minutes that we have. So Kristin, let's dive straight to the point. Why biofluorescence and why now?
Yeah, biofluorescence is an exciting, really exciting technology that we now are bringing into the United States more readily. And it's exciting with that, Asia's actually been using this technology for about 10 to 15 years.
Mm.
So we're gonna take some new technology from Asia and bring it more into hopefully every dental practice. Biofluorescence is the ability to see the pathogens, especially if they're 3-day-old pathogens. We can see them in the oral cavity because of light. And that is, there's a thing called porphyrins. And porphyrins is an organic compound. It's found in either its cells and organisms. And when you're looking at a pathogen, a bacterial pathogen, which we have in our mouth, if they get to that 3-day-old pathogenic state, so it can actually, a light can shine on them and then they shine back a longer wavelength with a different light. And it really just makes us see more clearly things that we cannot see in the mouth. And I think we are absolutely ready for this in our dental community and especially our patients for this technology because it's less invasive and it's readily accessible.
Yeah, yeah. I think we're just now on on kind of a upswing resurgence of what actually is in our mouth. You know, something like saliva. You know, we were before the call, you and I were talking about dry mouth just a little bit.
Yep.
Something like saliva, you and I are used to, okay, we need a dry field in the mouth. So we're just going to suck that saliva out of the patient's mouth. But the reality is we need that saliva in there because of the microbiomes, because of the biocomponents in it, because of what's the communities that are living in it. So when you're talking about a three-day-old pathogen that can somehow reflect back, this is fabulous. I think we're just on the tip of the iceberg with what's actually going on in our mouth.
We are absolutely on the tip of the iceberg, and it is exciting because we are ready to know more about it. And we're seeing that as we know that it's really about the early detection. If we can find the pathogens, we can find where we're missing, our patients are missing, or where they're located because they're invisible to us. We can then get them, we can treat them quickly because we know it's about the early game. And we got to get on it, the early game, to control it. And this is even with salivary testing, which I'm really excited about. I really believe that that's something that's going to be readily accessible and done regularly at dental offices. But we see in the salivary testing, it'll come back and we'll say, yeah, look, you have, you know, the red and the orange and even, hopefully not the purple, but you've got a lot of these pathogens. But where are they? Like, so the mystery is, where are they? Is it in a place that it's not going to matter what we do? We've got to find where that is. And it could be under a crown, around an implant, around ortho brackets. It could be under a filling. It could be around a filling margin that we had no idea. And so it's really exciting to bring this technology because it illuminates the really what we haven't been able to see and makes it much clearer.
It really is uncovering the mystery of the mouth. And I think that's where with AI, with the salivary testing, with all these new innovative products that are coming down the line, I really think that the mouth doesn't need to be a mystery anymore, right? We can now have early detection, eventually complete prevention. And it doesn't need to be a mystery. And I think that's best practices, right? From here on out is like, okay, let's see what we can do to prevent it. So where do you suppose that this illumination technology, where will it flow within the whole clinical flow of the practice? Is the assistant going to use it? Is it going to be the dentist? Is it the hygienist? What have you seen work with that?
So exciting things about that is it really has a broad scope of that. Especially the company that I've been involved with, which is IOBio. It's the Bliss technology. Their technology goes from even take home. They have a home technology that allows our patients to actually monitor at home. Like, this is amazing. Without dyes, without any mess, they can actually just use it to see the pathogens, the 3-day-old pathogens, and where they are and where they're missing. And it's an exciting thing to be able to actually not just have something that's clinical, but they could take home. Now, they also have amazing technologies that step up from there that provide even better, more distinct technology that is in the office. And absolutely, anybody can be trained on this. A lot of them look like a curing light or a camera. And we can take these photos and then we can keep them and store them and monitor them and be able to see, is this progressing? Is it not progressing? Is what we're doing therapeutically working? And those are great things. And our patients can do it at home too.
And that's what Dr. Miyasaki and I touched on briefly too, was when we have that data, when we have more intraoral photos, back in the day when those cameras first came out, or when we have more scans and more things like this, the more data we have on the patient, the better, because now we have that AI that can go back and analyze the data and come to conclusions. And then we take that and the diagnosing provider takes that and does what we need to uncover the mystery of the mouth, right?
Yeah.
So what do you think? I know you work a lot of times with teams to implement these technologies, and sometimes it can be hard to get the entire buy-in from the team. So what do you think works here as far as getting everyone on board, including the dentist, whether you work in a DSO or a private practice?
Well, I think our patients, for one thing, are ready for this. This is something that, especially in the United States, we're ready for less invasive. I just did a CE not that long ago that was a dentist was talking about how he is making incredible profitable money in his practice by doing non-invasive restorations or restorative measures without having to drill and fill. And our patients are ready for that. And so when we talk about, hey, it's not just something that is not going to bring a return on an investment. This is something that actually will benefit the patient. It will benefit the practice. And it is, in all honesty, it is providing for our patient for their whole wellness. And that's where my passion is. And it's individualized because you see individually what is happening in this patient's mouth. And you can then give individualized treatment. And we have a lot of new, great, less invasive restorative, like remineralizing agents that are out there. It's not just our old traditional ways of detecting decay and then restoring or taking it out and restoring it with a drill and fill. And so this is an exciting time. And I believe everyone's ready for this because we want to restore as much as possible of the regular, normal enamel, dentin, root, gum tissue. We want to keep that in our mouth as much as possible, but we want it healthy.
I think it's kind of a new mindset, new way of thinking, and it's tough to change to this mindset into minimally invasive care, or even something, providing care outside of the traditional brick and mortar, whether it's virtual care or mobile dentistry, portable dentistry. It's hard to break out of the traditional mold sometimes of this is how we run our business. This is how we run our clinical side of things. But I do think that as the generations kind of change in dental, as the decision makers change, and this will automatically kind of change as well without us even knowing it. So for you personally, why are you into pH? Why are you into, how did you get here in your career and with this particular niche?
Yeah, so pH, it was when I started really doing back in 2019. I had listened to Dr. Brian Novi, and he had spoke on baking soda. And I was really in a really natural, wanting natural products in my life. I had some autoimmune issues, and I really was desiring that. And for my daughter, who was a teenager that was struggling. And so we went kind of the whole natural. And in that, led me down this beautiful path of learning about pH. I'm a very big God person. And so I believe that I've been given this path to help others because my whole goal is really about, I'm super passionate about early screening for all diseases in dentistry. And I believe in the next 5 to 10 years that we will be primary screeners for all diseases in the dental practice, and I think especially with dental hygienists. And so pH is the driver of disease. If you don't know that, it's the pH, it's the acidic pH. Now, obviously, if it's alkaline, we're a lot better, but we can actually be too alkaline too and cause problems in our body. So there is this really great balance that we need, and there's the balance in everything. but I'm the PHRDH, and that's how I started. And it goes really to all areas. I'm very passionate about women's health and hormones and aging women, not just aging women, all women. And I want early screening because women are definitely at risk. And this is a great technology for them. Especially anybody with dry mouth, anyone that's, struggling with anything. This technology goes to fit every single need, from the young child with its first tooth to the oldest person that we have in our dental practice. This technology is beautiful, it's less invasive, and it does allow us to see the incipient lesion, like just barely demineralized tooth structure, or could be demineralizing structure. So we can get on it, because it's about the early game. It's about getting on it and fixing it quickly, so we don't have to do the big restorative procedures. So it's exciting, and I love it. I love the whole topic.
It's a new era, isn't it? I mean, especially with this, it's easy to use, it's easy to implement into the workflow, it's easy for the patient to understand. And I think that's what sometimes we overwork ourselves, and you know what it is when we think too critically, when really the solution is easy. And I know the technology behind biofluorescence is not easy, but implementing this is. So Kristin, thank you for being here. Where can listeners find out more about you?
I have an Instagram. I'm the PHRDH. And I'm also on Facebook, and I am on LinkedIn. I love to be on LinkedIn. That's a lot of times where people can see me. They can also get on my speaker packet on LinkedIn. But please, yeah, I love to speak on especially bone health, women hormones. And I love to talk about, all of this. And it's really just about early screening and getting in there and just treating people so that their systemic system can also be healthy, and they can live really with longevity and have a good life. And that's what we want, with their teeth intact.
Time to be proactive, not reactive. I love it. Well, Kristin, thank you for being here. Thank you to everyone who is listening. And don't forget to go ahead and register for the August 26th webinar at sparkstudyclub.com. And Kristin, we will see you then. Thank you.
See you then. Thanks.